Hello, I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Let's meet one. So, Matilda, thank you so much for joining us today on Here for Good, the Inside Edition.
Thank you, Dennis. It's an honor to be here.
Well, actually, the honor is mine, and I would like to start by you just sharing a little bit about your journey here at Virtua.
So I joined the family in 2011. I joined as the director for the oncology units in Mahali. And in 2019, I had the privilege of being appointed the site administrator, like the director for the cancer center. So I moved from Mahali to Moorestown.
And this is the Samson Cancer Center, right? And that's when it opened, was it not? Okay.
Yes. It's a beautiful place and a wonderful, amazing team, and I love it there.
Yeah, it's a great place. I remember being a part of the opening ceremonies and obviously have been back many times. Tell me a little bit about your responsibilities.
So as director of the cancer center, we have multiple departments. We have the registration, we have pharmacy, we have radon, we have the security, making sure that all departments are working seamlessly to provide a phenomenal experience for the patient. So I oversee that, make sure that everything in the facility is working right, to make sure that the experience is what it's supposed to be.
Managing multiple departments, as you just mentioned, can be a challenge in of itself. How do you keep all of our colleagues engaged?
I lead by example, and I make sure that we have connections together. We, instead of being siloed, we have programs like the Oktoberfest, bringing everybody together.
Oktoberfest?
Yes.
Nobody told me about that. Does it?
I'll invite you.
Okay, all right, sure.
So we get everybody into the same space. We break bread together, we talk, and we connect, and then we refocus on the patient.
So I understand that you've also been a tremendous advocate for practicing excellence, especially when it comes to, in part of practicing excellence, we get to watch a lot of videos with tips on a lot of different things. But one of the ones that really stands out for you is the one around listening. Can you elaborate a little bit on that? My dad, when I was growing up, he used to tell me, he said, if you're talking, it's difficult to learn anything. The best thing you can do is to learn to be a better listener. So help me understand why that one is so important to you.
Because in the outpatient setting, our time with the patient is limited. Mm-hmm. You're not in an inpatient ward where you have 3-4 days. Your time is limited. So then you have to be intentional about listening to the patient. You're listening to see, to hear, to feel, to understand, so you can help the patient. When you do that, you're able to understand, and then you can help them.
He used to also tell me, he said, if you listen well enough, people will tell you what you need to know. Awesome. And that's that intentionality that you speak of.
That is what draws the story out.
If I recall, you are from Ghana,
yes,
correct?
Yes.
That's where you were born.
Yes.
And how long did you live there?
For 25 years.
And when did you come to the U.S.?
In 1989.
In 1989?
Yes.
And since then, you have continued to work to give back, and I know you've tried to do things to help advance medical care in your home country. What are some of the ways that you go about doing that?
The most recent thing that I'm so proud of, we had a situation that my cousin ended up with renal disease at age 40. In working through, we recognized that there was a deficit. Chronic kidney disease is a huge issue, and we only have one modality of treatment. Just 1% of the patients benefit from peritoneal dialysis, which is much more less expensive. So in working with the professors at the teaching hospital, they engaged me as the president of the North America Ghana Nurses Foundation, and I was able to intervene by going down there to teach nurses about this treatment modality. First, we started on Zoom, and then I traveled there to teach them hands-on.
How
dialysis.
frequently do you go back?
At least once a year. But it looks like in the coming months, I'll do more visits because we're setting up a lab to bring more nurses in to train more people. So maybe I'm hoping to visit 2 or 3 times this year.
Your dedication, both professionally and personally, is admirable. And so I really can't thank you enough. What motivates you to continue to sort of pursue this?
My desire to see people live their best life. Helping people navigate life, the little I can give is to help them live better, educating them, encouraging them, supporting them. So that is what I have to give to society to make it better.
What are your aspirations for the future?
I just want to continue to improve or contribute to the landscape of nursing, the expansion of, right now we have technology, all these interesting things that are coming into our space. I want to be able to pioneer some of these things to help, make it better.
You're embracing the thought of augmenting, nursing care with technology, and you're one of those persons that embrace it.
Absolutely. It is necessary. It is necessary. I think about using AI to support even this venture with the dialysis. How do I use that from here in the United States to impact Ghana?
You're not fearful that AI will replace certain skill sets. You're more in tune with it will augment and help to deliver care to many more people that might not otherwise get it.
Absolutely. I think it's a win-win situation.
What do you enjoy most about the Virtua family, the community that we have become? Because as we look at the sign behind us that says "Here for Good," what is it that gets you up in the morning and makes you come to work?
Knowing that I'm truly here for good, that every action that I take would either impact my colleague in a better way or my patient's life in a better way. The camaraderie that I feel, the support, the collaboration, that is what makes my heart beat every morning. I'm a virtual lifer. My friends used to laugh, "Oh, you're a virtual lifer." I said, yes.
That's a good thing.
I'm a lifer. And I think Virtua is positioned right in the community. There are amazing things that we're doing. I proudly wear my Virtua t-shirts over the weekends because we're truly here for good.
In the patient population that you get to interact with the most, obviously are oncology patients that are being treated for cancer. How do you encourage those colleagues that are in your portfolio to show up every day for those patients?
I tell them that we are uniquely positioned in the life of a patient who is in a difficult place, and you have the key to turn the light on. Even in death, we're there to soothe, to encourage, to comfort. So that is what I tell them, that we are pivotal in the trajectory of cancer care, and we can't drop the ball.
I don't think there is a better way to end this segment than repeating what you just said in terms of having the key to turning on a light for someone that might otherwise be in a period of darkness. And I can't thank you enough for all that you do for Virtua and our patients.
It's an honor. Thank you, Dennis.
Thank you so much for tuning in for this just touching episode of Here for Good, the Inside Edition. Stay tuned, and we look forward to sharing more incredible colleague stories with you in the future.